All right, and welcome to our North Central Regional Report Out call. We're here every Tuesday at 2:30, give you an update on what's going on with the COVID-19 response in your region, to hear from public health and to hear from hospitals and others about what's going on. We have a good group here for this call today for our discussion, and I will I'm letting people in here. And I will get started straight away with our dashboard here for this region. Hold on one second here. All right. Okay. As you can see, North Central, a qualifier here before I get into the numbers is so when we look at this 0% of staffing, you'll notice the word critical here, critical staffing. And so I just want to make sure I was clarified, as the critical staffing issues have gone down compared to recent weeks. There are still staffing shortages, and we are still asking a lot, particularly of our nurses, in covering shifts and extra patients and things like that. So I just want to make sure when you see 0 there, it doesn't mean that everything's great in the world from a staffing perspective. It just means we're beyond the critical part of that. Okay, coming and looking at our hospitalized COVID patients in the North Central region, and I found it helpful to look back 2 weeks here this time. So this number 2 weeks ago was 82. Hospitalized confirmed or suspected COVID patients in the North Central region. Last week, 52, this week, 32. That's great to see that number going down like that. ICU beds with confirmed COVID patients, that's gone from 6 to 4 to 5 here the last few weeks, so holding steady. And then adult staffed ICU beds available. That is at 12 this week. It was 16 last week. This is a really fluid number. It moves throughout the day. But that gives us 43% availability in this region. Good news down here, as you can see, as we hit this peak in November, December, the numbers have been coming down here in January. 831 2 weeks ago. These are new cases each week. 521 last week. 404 this past week. That's good to see that number going down. And I'll tell you too, I'm going to flip over here. This is the positivity rate chart. Ignore these last bubbles. They're kind of in process for the coming week. But we're 2 weeks in a row here. And when you look at North Central at 8.71%, that is the lowest number we've seen since October from a positivity rate on these tests. So last week, 9.3, then over 10, over 15, and you get back here to the week of October 11th before we saw numbers this low from a positivity rate standpoint. So that's also good news to share as we look at things. So let me come out of that, and I'd like to pass it over to Carrie Ann, and if she can give us an update from public health.
Hello, nice to be joining you guys again. Not much new really in the health department world, other than really ramping up for vaccines with moving into phase 2. I'm just trying to make the plans as to how we roll that out. I think most health departments in our region are feeling the same pain. We're not getting very much vaccine, especially compared to the number of calls that we're getting every day of people wanting the vaccine and then prioritizing within the phases. So I think that's the big ticket item that all of the health departments are working on right now, is just that prioritization, setting up how we're going to give them, and just partnering up with other people in our community on getting those out as quick as we can. So hopeful that we continue to see our numbers trend downwards. I know this week for me specifically, I'm a little nervous with our numbers this week. They've kind of picked up this beginning of this week. I hate to say it, but I think football watch parties are killing us. So, but hopefully we can keep those to a minimum. And I think we just still need to continue to urge the public that we're not through this. We're still in the midst of it, and we just still have got to use our precautions and I'm getting a feeling like things are getting a little bit lax. But hopefully we can keep going strong through this, get people vaccinated to hopefully then see a light at the end of the tunnel. So I think that's what we're seeing health department world.
Thanks, Carrie Ann. You know, you may only be able to speak for your county, but is there a way for people to sign up if they want to know when's their turn, or to be notified when their section is up? Do you guys have
I think a lot of places are doing where you can call in and get put on a list. Now I know, like with us, we have partnered with Ellsworth County Medical Center, our local hospital and clinic here, to determine the prioritization within our county. And we prioritize schools first. We're hoping, we did one of our districts last Friday. We're going to finish up our other district this week. We're working on first responders and finishing those up this week to hopefully then move into the 65 and older. But yeah, I think most of us are taking the list. The list is just a lot longer than the number of vaccines that we're getting. So it'll just be hard to determine who gets it when. So, and the other struggle we're having is we have people calling from all over. I mean, multiple counties, just getting on as many lists as possible. So that makes for another added struggle.
So I'll just point something out here for people. So every county gets to decide how they tackle phase 2. And so, for instance, some counties are starting just primarily with age. So like Central County is 83 and over right now. Some counties like Ellsworth, it sounds like, are tackling teachers or first responders first. So you really need to pay attention to your county and what's going on. I bet Carrie Ann, I appreciate this. We did hear earlier to encourage people to check the website or the Facebook page of their county health department before calling, to help save maybe from having to field as many calls in the department. But if you do have questions, to reach out. I see Lincoln County Health Department, LaDonna on here. LaDonna, I don't know if you have anything you want to add to that process. And you may just be listening today. Okay, we'll let that sit. Thanks for that. We'll talk about vaccines again here at the end, but Carrie Ann, thanks for that perspective. Let me pass it over to Heather to hear from the hospitals.
Hi, I'm Heather Fuller. I'm the director of the Sunflower Health Network with hospitals in North Central and Northwest Kansas. I think right now we are seeing a huge push with the vaccines, a lot of focus on that. Like Carrie Ann mentioned, here in Saline County, the hospital and the health department, and then the FQHC, the Salina Family Healthcare Center, those three are working together on the community vaccines. So they've got a location secured. And here they're doing vaccinations right now. They've started for 65 and older. And so firsthand experience I've heard from, that's going very, very smoothly out there, getting folks in, getting through. So I think people are really excited that we're getting to this point and they're able to get those vaccines. So I think, you know, just as others have mentioned too, keep wearing the masks. I've seen more people think, oh, well, here we go. We don't need to wear those anymore, but need to stay vigilant about that kind of stuff right now too.
Yeah, Heather, let me ask you a question. Do you know how many people would qualify for phase 2 in Saline County?
I don't know how many people total. I know that the slots that they had available with the amount of vaccine they had filled up in 30 minutes. So people were excited. They were ready to get on there and get in. So I know there's a lot more folks that still need to do that.
Yeah, and Carrie Ann, maybe you know the answer for that for Ellsworth County. Do you know how many people qualify?
I don't. Phase 2 is such a large portion. I mean, when you put in critical workers, and in the small counties, it seems like that engulfs pretty well the majority of the individuals. So I don't know that number off the top of my head.
No, that's fine. I was going to try and localize it, but I can put it at a state perspective for everybody. So there are 1 million people in Kansas of the 3 million that fit into phase 2. And last week we received about 45,000 doses from the federal government. And so you can do the math there, that if that takes 20 weeks to get through phase 2, which is around 5 months, the hope is that we'll start getting more of the vaccine into the state. But that paints a picture for what we're dealing with from the supply side and the demand side. Certainly high demand right now, low supply. Heather, I'll let you keep going.
Sure, that's really all I had just to say. I mean, the hospital and health department and Salina Family Healthcare here are working so well together to get that out as quickly as possible. I know Dr. Bob Kraft and Dr. Rob Freelove have really spearheaded that effort. And so huge thanks to them to get that going for this area. And then I wanted to introduce Linda Slichter, the infection control and employee health nurse at Clay County Medical Center, and Penny Johnson, I believe, is on as well, the director of nursing at Clay County Medical Center. And I'm not sure if Dr. John Kelly is on as well, but I'll turn it over to you guys from Clay Center.
All right, I'll go ahead and start, Penny, if that's okay with you. My part of the presentation today is just talk about some of the numbers that we have here in Clay County. In our county, we do primarily do all of the COVID drive-through testing through our facility. So it gives us a pretty good measure of what the testing rate is for our community. And we have dropped down to about 8 tests each day for people that want to get tested for COVID actively. Our numbers are matching what we're seeing at the state level, that the number of tests requested have gone down, the percent positivity has gone down. We are averaging around 4 to 5 inpatients, not just active COVID, but post-COVID as well. So all of those have been improving, as have our team numbers. We currently have 0 active COVID infections in our hospital staff, which is phenomenal. We have 49 of our 270 have recovered from COVID. 1 that's on modified quarantine right now. As far as vaccines for our facility, we have 31 team members that have received both doses of COVID now. We have 83 who have received 1 dose and will get that 2nd dose in the next couple weeks. And we have 156 who have not received it. Of those, only 4 of them are waiting for more vaccines to arrive. The rest are waiting to see how everybody does with the vaccinations. We were able to vaccinate an additional 28 healthcare workers in our county with the vaccinations that were distributed to us. And that includes eye doctors' offices, dental offices, pharmacists. So working with our health department, we've pretty well covered the first responders and the healthcare workers throughout the community. Our challenge from my standpoint is to keep continuing to maintain all that data and that daily reporting at so many different levels, and then coordinating the efforts with the county health department as we move into phase 2, trying to see what we can do to help them, because we do want them to take the lead on vaccinating the general public, and then just communicating that out to everybody that they are the source in Clay County to go to for COVID vaccinations. And with that, I'll hand it off to Penny.
All right. I just really wanted to talk about our staffing challenges. Really, we've had our staffing continued to be challenged with addressing the going in and out of the COVID patient rooms and treating those patients that have recovered from COVID, keeping our clean and dirty patients separately, because we have an OB mission that we have to have staff that are in the building to handle any OB that might come in. And so we want to make sure that they're getting the highest protection possible. We have had quite a few nurses ourselves that are expecting babies, so trying to keep them safe, but appropriately staffed as well. And then hitting that target of, quarantine advice days. How many days is it? 10 days from this day, that day? It seems like it's a fluid number with some people because they can't actually pinpoint when they were exposed. But as Linda mentioned, we're seeing less and less exposure and less staff members being out. We have only had to have a couple of travelers in the facility, but we are also going through a conversion to a new electronic health record and doing a pretty significant construction remodeling project. So our staffing concern is not always just around the COVID population. It also has our own challenges that we have taken on at the hospital. So that's kind of a brief staffing update. I'm going to turn it over to Dr. Kelly, and he is going to wrap it up.
Yeah, so I was just going to touch base with just where we're at with vaccinations and stuff in our community. And, you know, Linda had already mentioned that we have accomplished getting our staff and our first responders vaccinated, or at least in process. I mean, some of them haven't had their second round yet, but we'll have that soon. We're kind of working with our local health department and emergency preparedness to be available if, you know, by some reason we would get a large shipment of vaccine in, that we can help with a mass vaccination if needed. So we've kind of got some plans in place for that if needed. But what it really looks like for our community is that we're probably going to be vaccinating about 100 a week at the local health department, and that really won't involve us here at the medical center, except in the case of patients that are at high risk for anaphylaxis. The health department's asked us to kind of help troubleshoot with those higher risk patients for an allergic reaction. And so what we're doing is we're going to try and just collaborate with them and provide the facility and the outpatient facility in our ER space for them to administer to those patients that they are worried about being high risk for anaphylaxis. That way we can monitor them and make sure it's done safely. Around that same issue, we found there is some misinformation in the community that it might be helpful for us to talk about, is, you know, that some people are under the impression that if they have seasonal allergies or hay fever type allergies, that they can't have the COVID vaccine. And some of you may have run into that same scenario, but some of our patients are concerned that they won't be eligible for the vaccine if they've had just allergies in general. And so one of our points of education for the public is just to really try and help them differentiate and understand what would make them in that high risk category for anaphylaxis, where if they've had a serious allergic reaction to something in the past, then they're a little bit higher risk, and we want to watch them more closely. But other than that, you know, as has already been said, it is so nice to see numbers coming down. It's so nice to have more options available for combating this virus, and it feels like we're finally moving in the right direction. So we'll just keep our hopes and prayers moving in that direction.
Perfect. Thank you, guys. My family hails from Clay Center, so I got a special soft spot in my heart for y'all. And it's nice to see Linda, such a huge Chiefs fan. She painted her wall this week just to get ready for the Super Bowl again. No, we appreciate the way y'all are carrying, and to hear the way that communities are bonding together. And a great shout out too, just with that seasonal allergy update, because I do know that is confusing for people. So appreciate you making that clear, and all that you guys do on top of what you'd normally be doing this time of year. Let me pass it to our friend Dr. Watson from Cheyenne Mountain Software to give us an update on the transfer situation, as we've tried to monitor that over the past few weeks. Dr. Watson.
Great. Yeah, thanks. And it is a great situation to be in, where we are seeing more capacity across the state, and that overall moving patients around the state has gotten easier. Wichita still remains tight. And I think, you look at Salina. Salina is also tight as well, which we know that's due to a lot of factors, staffing and otherwise. But overall easing, particularly in the smaller centers, and I think that bodes well for also down the way, that when we talk about what's going to happen in the future, the numbers substantially lower across the board for the North Central region, and people are moving. We're seeing more non-COVID patients moving now, and I think that's encouraging. Wait times are lower. The number of people asking for assistance finding beds are lower. The acuity levels are lower. All across the board, the numbers are showing us that the demand on the system for North Central is really improving. So all good news. I think we'll see what it looks like over the next couple weeks. We know that the spring spike will be upon us, but hopefully with the vaccine and everything else happening, that we're going to mitigate a lot of that effect for sure.
Thank you, Dr. Watson. Any questions for Dr. Watson? All right. So Dr. Marcy Nielsen, who's been kind of part-time helping the state in their coordinated response to COVID, has come on full-time this week, and she's been able to join some of our other calls. She got pulled into a meeting with the governor, who outranks us today. And but if you want to look at some of the earlier calls or some of the later calls, you can't hear from her, but I'll attempt to summarize some of what she said. She is now the chief advisor for COVID-19 coordination and is leaning into the vaccine distribution, communication, and coordination across the state to help make that even more improved than what it is now. But let me start by pulling up the website that we talked about, kansasvaccine.gov. I showed this to you last week, and they've updated even since then. But when you go to the website, kansasvaccine.gov, and you click on data here, it pulls this up, and you can see again how many people vaccinated, first and second doses, how much has come into the state, and how much of the state population's been vaccinated. That was 3.5% last week, 4.5% this week. So we are moving up the ladder here, and then you can see just who of the people who've gotten the vaccine, what their ages are. We're reloading there. The Moderna versus the Pfizer, the gender of who's been getting them, and then you can see kind of the distribution by week on first doses in the green and second doses here in the orange. And then I found this table. This is new to be helpful, so you can see how many of the vaccine is coming in. And this is both first and second doses, I believe, coming into your county each week. So this is this week we're in. You can see Clay County getting 100, and that's what they mentioned on the call here, what they may expect to get each week. Ellsworth at 100 here, and I'll come down to Saline County, 500. And so, like we said, the phase 2 group is a large group, and this is, how the state's dividing this 45,000 doses that's coming in, and they do have an algorithm that they push that through. The most dominant weighted factor in there is the percent of the state population that you are, and the percent of your population that is in the high risk category, and then they go through a variety of other weighted averages inside of that to get out to what's coming out each week. So that's helpful on this website, just to be able to see what's going on with the vaccine and where it's going and what we're seeing. I just ask if there's any other kind of comments or clarifying things that anybody wants to add to the conversation around vaccine for this week. And on our call next week, we'll continue to stay focused on it because I know there's a lot of questions. Anybody, or our guests from Clay Center or Carrie Ann, Heather, Dr. Watson, anything you'd want to say? All right. I think you all shook your head no at the same time. That was pretty impressive. It's like it was coordinated. I want to, as always, I like to end on bright spots. I didn't know if did anybody have one from the North Central region? I have one from a couple from the state that are pretty good. Anybody have one? And down in Pratt, Kansas, a couple donors donated $95,000 and paid off the medical bills for 430 families this past week, which was a great surprise and benefit to many people. And then we heard this story out of Eureka, Kansas on our call earlier today. Really touched me. A person had fallen and broken their hip and ended up in their hospital there in Greenwood County. And that person mentioned to their nurse that they had a pet at home that they were worried about. And so that nurse went and picked up the dog and has kept it in her own home while this person's recovering. And a great pet lover story there, but just also just kind of the personalization and the care that people are given across the state, and that human and human to dog connection that's out there. So let me give you a list of websites for information for you. covid.ks.gov/report-outs is our website. It's got past conversations, the dashboards. You can also sign up to get this sent to you into your email box. If you have questions, ksregionalreport@gmail.com. For us, if you're looking for a place to get tested, go gettested.com/Kansas. And for vaccine data, kansasvaccine.gov. Thank you all very much for being on with us today. We'll be here this next Tuesday at 2:30 to talk about the North Central region. Thank you, everybody.